Okay, here's a shocking statistic from the American Cancer Society. Each year, there are more new cases of skin cancer diagnosed, than lung, breast, prostate, and colon cancers combined. I know that's shocking. But today is Melanoma Monday, and we're bringing awareness to this morning with dermatologist Dr. Melanie Palm. Dr. Palm, thank you so much for coming in. We do appreciate your time. And we need to talk about how serious this is because, as we were talking during the commercial break, melanoma is one of the leading causes of cancer deaths for people very young.
Yeah, it's true. About a person an hour passes away from melanoma. So we think, according to recent statistics, somewhere between 75 and 125,000 new cases are diagnosed every year. Just did a skin cancer screening this weekend. I think I found another one.
You found another one. Let's talk about why these melanoma cases continue to pop up more and more. Are people not getting the sunscreen message? Is the sun stronger than it used to be?
Well, I think good thing is early detection. I think we're actually educating people, so we're actually finding more cases and finding them earlier, which is how we want to find them, because melanoma, if it's in advanced courses, much more difficult to treat and life expectancy goes down. So we really want to catch things at the beginning stages. You know, sun exposure, we know about 70 to 80% of melanomas are related to UV exposure, of which tanning beds and sun exposure play a role. So also making sure that, you know, you're reapplying sunscreen, being smart. I know we live in San Diego. I want people to enjoy their lives, but wearing appropriate clothing, avoiding peak hours, that sort of thing.
Okay, let's talk about what we should actually be looking out for. And I think that this is where I might have more knowledge than I wish I did regarding the subject. But they talk about the size of it, the color of it, sort of the ABCs of it. What are we looking for?
Yeah, so if you go to the American Academy of Dermatology, they actually have a campaign called Spot Skin Cancer. And we've got something called Who's Got Your Back, because one of the common areas to get melanoma is on your back.
And you don't look back there. You can't see back there, right?
Exactly. And so if you go to that website, you can find all sorts of information about what to look for. We typically talk about the A, B, C, D, E's. A for asymmetry, one half doesn't look alike. B for an irregular border. Color, if there's two or more colors, or funny colors. If it's white, blue, black, or pink, we don't like that with moles. D, diameter, if it's large, but E is the most important, evolving. If something is new or changing, it just doesn't feel right. It's a mole that suddenly becomes sensitive to you. It bleeds, it gets itchy, something like that. You need to get it checked out.
Okay, and these can be very small, the size of a small freckle. It doesn't necessarily have to be a big black mole that you're looking out for. Just look for anything that might look slightly different.
Absolutely. I mean, they really can look like nothing specific or not something concerning, which I think is sometimes why we see advanced cases. But you have a new spot that you're age 30 or beyond, you want to get it checked out. Just something that doesn't belong with the rest of your moles, like the ugly duckling, you want to get it checked out.
Now, let's also talk about, you know, me being fair-skinned. I might be more prone to something like this, but that's not always the case, because I think that there's a mentality out there that if you have that naturally beautiful olive skin, that you're not at risk for this. That's not true.
That's very true. Everybody can be affected by melanoma. So Hispanic patients, Asian patients, African American patients, and actually in the African American population, we get something called acral melanoma in a little bit higher proportion than other populations. So getting something on the palms or the soles of your feet. So that's why you really need to check in nooks and crannies. Once a month should be checking yourself at home. Once a year, check yourself out with a board-certified dermatologist. Even more frequent if you've got a history of skin cancer.
And you dermatologists take this extremely seriously. If you see something that comes back with a biopsy that it's even very early stage melanoma.
Oh, we get you in as soon as we can. It's something that we don't want to mess around with. I think we're glad we're here because we find them early, but it's the bane of our existence because we hate that it's around, but we want everybody to look at their skin and get checked out.
Would sunscreen protect everybody in the future from something like this as much as you possibly can?
Well, genetics play a role, so it is environmental and genetics, but wearing sunscreen and avoiding some of that UV exposure that can be cumulative over time definitely decreases your chances of skin cancer overall.
All right, we're flat out of time, but final word here for people that are still using those tanning beds, still after all we know?
Oh, they're awful. I mean, they were recategorized by the FDA because of sort of how they behave. We know that they cause melanoma. We know that they cause skin cancer, so avoid them.
All right, it's not if, it could likely be when, if you're still one of those people using those tanning beds. All right, Dr. Melanie Palm, thank you so much for coming in. We appreciate your expertise on this subject.